Okay? Are we set? Okay? We'll have a little fun with this. Anyone want to put a wager on Sun or Park? The betting can go on the side here. Alright. No cheating, you guys. Okay, are we set? Ready? And they're off. Go! And it's the race on the ball. We got Park takes the last available bid. Darcy Lucky. Actually, rumor has it that the other seniors said, no, we don't want it, so we're just going to let them take it.
Recovery is on the bed.
All right, thank you guys.
First, there are not enough beds in nursing homes and auxiliary hospitals that are designated for the heaviest levels of medical care for seniors. The unacceptable numbers of seniors waiting for beds are proof of a bed shortage. The government has tried to ease this shortage by introducing several new levels of care. The designated supporting level 3, 4, and 4 dementia spaces that are often referred to as nursing home light. These DSL beds provide less medical care than the traditional nursing homes, but more than traditional lodges or seniors residents. However, there are legitimate concerns that many seniors placed in these lower levels of care actually need the higher level provided in nursing homes. And these beds cost seniors more money, a lot more money. Care that is paid by the province in nursing homes is downloaded onto the patients in DSL facilities. Many of these new DSL facilities are run by for-profit companies that require a significant return on investments that must either come out of the care provided or out of the patient's pockets. Neither of those options are good for seniors. Moreover, the fact that there are still long waiting lists for nursing home beds tells you that either there are not enough beds or these DSL beds, or they do not meet the needs of the people on the waiting list. And there are other flaws in the system.
To hospital on July 3rd after living on his own without support, only family help for more than a decade. I thought July 3rd, it's the same as what Carol Ann said. What an awful coincidence. And I realized it's not a coincidence. It's happening all over the place every day. This is what's happening to Alberta seniors. Let me tell you about his experience. He went into hospital, he was treated over an extended period of time. Finally, on August the 16th, from July 3rd to August 16th, he was placed in a long-term care facility. He lasted 2 weeks, and he's now back in the hospital. I want to give you just a quick sense of the pieces of this. And I want to say that there's very good news in this. First of all, the good news is that while he was in that hospital, before and after the long-term care, and even in the long-term care, if you look at the people helping him out, I was absolutely amazed by the caring, committed, skilled efforts of so many healthcare professionals. I'll tell you, RNs, LPNs, social workers, doctors, aides, support staff, physiotherapists, occupational therapists, all these skilled, committed people in our hospitals and healthcare system. But the downside is their hands are basically tied behind their back by a system that doesn't let them do what they know how to do and what they want to do in the system. And the responsibility for that is right here in this building. Make no mistake. So I think we should right now say thanks to all these people that you've heard from and heard about who are trying their best to treat your parents and grandparents in the way that Yolanda described. Let's hear it for those healthcare workers and professionals who are doing this kind of work. And what we need to do is put the tools in. This isn't some healthcare problem. This is a political problem. You notice the big renovations that we're doing? Terrific, eh? Cosmetic architectural changes. I'll tell you the renovations we need. We need a full-scale renovation of the people who run this government. That's what we need. You take a look at what they've been doing. What they've been doing is standing up and protecting the wealthy and powerful. How many trips has this premier taken to Washington to support the energy sector? to say we're doing the best we can in the environment. Please build another pipeline. Now, by the way, I'm a supporter of Alberta's energy sector. It's important, and that is the job of government. But isn't it at least equally important to support the vulnerable, the aged, the frail, and people who need all of our help? Isn't that their responsibility? My approach is basically a very simple one. You get more active, you get more angry, and you get more allies. And anger, I have to tell you, is appropriate. This is not a please sir, more gruel approach. You can't just go and ask. You have to demand, and if you're not angry, nothing's going to happen. So get more angry. You're entitled to be angry. Get more active and get more allies. You look, Friends of Medicare, the opposition parties, Public Interest Alberta, community organizations, these unions that are doing such a terrific job in supporting public sector workers, your neighbors. We've got lots of friends because basically everybody's got parents and grandparents. The question is, are you going to get more active? I'll tell you something very simple. Your parents and grandparents will not get what they need, and they will not get what they deserve. They will get what you fight for. And that's it. They will get what you fight for.